Animal-Assisted Therapy, Effects for Pediatric Patients with Chronic Disabilities, presented by Blosser, Amy Lewis, and Madison Meadows.
Animal-assisted therapy is defined as a goal-oriented intervention in which therapists use animals to help improve an individual's physical, social, and cognitive client factors. Animal therapy dates back to 1792 and has been shown to decrease blood pressure and improve motivation and engagement in activities.
Our case study that we reviewed was of a 2.5-year-old female. She had right mild side hemiparesis. Another issue she had was a strong temper, and receiving OT services in the presence of a cat helped to improve some of her motivation and helped to complete different occupational tasks while the cat was present.
Our evidence-based practice question is, does animal-assisted therapy improve motivation and occupational performance in children ages 2 to 12 with chronic disabilities compared to traditional occupational therapy treatment interventions not involving animals?
Okay, our levels of evidence include, for level 1, we have 2 randomized controlled trial studies and 1 systematic review. For our level 2 set of evidence, we have a 2 groups study. For our level 3, we have a pre- and post-test study. For our level 4, we have a single subject design. And for our level 5, we have a clinical practice guidelines based on expert opinion. And then finally, in our qualitative studies section, we have 2 different studies looking at different qualitative designs.
When we were researching, the inclusion criteria we looked for was therapy treatments that used animals, had a population of pediatrics and adults with physical or mental disabilities, and were related to the health care field. Our exclusion criteria were neonatals and children or adults that had a fear or allergies to animals.
The next couple of slides, we're going to go into the summary of evidence. We split it up to be level 1, 2, and 3, and then the other levels in future slides. The first bullet point showed that there was an increase in movement by obese children in the presence of a dog. This clinic looked at 12 obese children. They each had an accelerometer attached to them. They did physical activity in the presence of a dog, and then the exact same type of physical activity in front of a friendly adult, and it was shown that these children were more active when in the presence of a dog. The next study was a pre-test, post-test design with dolphin intervention. It was a dolphin training therapy program in the Ukraine that was for 2 weeks at a time that children would attend. Their parents would actually receive questionnaires about their children's participation. It had a alpha therapy training, and this was to show that there was interaction between the dolphin and children. And the children had multiple skills and age levels. There was also a therapist in the pool to help scaffold children to have better interaction with the dolphin. Before the 2-week program, the parents were given a questionnaire on their child's motivational level. After that 2 weeks, where the children interacted with the dolphin, each parent was given a questionnaire, the same one, regarding their children's motivational level. And after reviewing both of the questionnaires, it showed that there was an improvement in child motivational level. The next study looked at the effects of client factors in children receiving occupational therapy pieces in the presence of a dog. These children's heart rates and blood pressure were assessed before and after the therapy session with the presence of a dog, and then some without. They gave out an occupational therapy participation scale to measure the child's motivational level. This was a really interesting study. However, the results were not indicated, so we weren't able to tell from that particular study what the effects were. The last study was a comparison of an engagement with a dog in therapy session, and then also a session with just sensory tabletops. So with that one, they compared the sessions that had a dog and then sessions with the sensory tabletop with children with upper extremity movement issues. Half of the children would participate with the dog first, and the other half would participate with the sensory tabletop, and then the groups would switch and have the same amount of time with each session. The therapist timed each group to see how long they were engaged in the activity, one activity being with the dog and the other activity being with the sensory tabletop, and it was shown that children were engaged longer with the presence of a dog than when using the sensory tabletop. To continue with our summary of evidence with levels 4 and 5 and then qualitative studies, our first bullet point was a clinical observation of children receiving occupational therapy services in the presence of a dog. This qualitative study took observations of 3 different groups: the researcher, the dog handler, and the therapist. They would receive an interview post-treatment session, which there were 6 total. After all the sessions were done, each person, the researcher, dog handler, and therapist, completed a questionnaire to determine their thoughts about using animals in therapy. The next bullet is guidelines for animal assistive practice, and a working group developed specific guidelines when using animals during activity. It was meant to develop a standard in healthcare facilities for when animals visit patients. Next was a single subject design with a boy with autism. A therapist was trained with a dog to work with this boy who had issues with aggressive behaviors, poor social skills, and anxiety. She had 1 therapy session with the dog and 1 without. The study showed a significant improvement for the child and his behaviors when in the presence of a dog. For another qualitative study, there were some common themes that were developed for animal-assisted therapy. Occupational therapists and occupational therapy assistants were interviewed, and they developed themes when using animal-assisted therapy. Some of the themes included social interaction, home-like environment, and motivation. Both social interaction and motivation showed improvement when working with an animal. The residents were also interviewed and similar themes were developed. It showed the benefits in using animals to restore lost roles, help learn new occupations, and preparing to learn new social skills.
Now I'm going to talk about the appraisal of certain of the evidence studies that we reviewed. The first study was a systematic review that was difficult due to the different outcomes and the different interventions, such as pigs and dogs and cows were used. There have not been many systematic reviews done, so this was one of the first ones done, but it was heterogenic because of the different outcomes and the different interventions. The next study that was reviewed was the study between the tabletop activities and the motivation of using the dog and staying engaged. This one had too small of a sample size, and there was a crossover design used so that there wasn't a sequencing issue to try to avoid bias, but because of the small sample size, it probably is not very high level of evidence. The next level was had a small sample size, and the evidence hasn't been published yet. There was only 1 researcher on the publishing, but the amount of motivation level of the children in services in the presence of a dog was really beneficial to our EBP question. There was no blinding. The third level was the pre-test and post-test design. There was a small sample size, and we do not know exactly how many participants were chosen, and it was not specific about how the sampling was done. There was a high cost of the intervention in using the dolphins, and parents were the ones that were determining the results of the outcome measures, so that might have affected the results by putting what they really wanted to see in their child rather than what improvement had actually occurred. The next levels of evidence that we're going to appraise are levels 4, 5, and qualitative. The first study is a single subject study that was a level 4, and it was a boy who was 12 years old with autism. He met all the qualifications of our EBP, and it was very relevant to our EBP question. They used blinding and masking in the design. The tester who selected the patient was different than the person who actually did the therapy. And then there were 2 other different individuals who did the video encoding at the end. And it was very clinically realistic because it is a one-on-one study. The next study was our level 5, which was an expert opinion based on the appraisal. It did not meet a majority of the qualifications. It didn't go into enough detail about how participants were chosen, how the data was analyzed. It didn't talk about cost at all. It didn't talk about what could be done in the future to change, but it did provide a good foundation for working with animals to have guidelines such as safety measures and certain hand washing, etc., when dealing with animals in a clinical setting. And finally, the last was the qualitative study. And the first one was, it increased the likelihood of bias because the researcher did do the entire study from the beginning to the end. And then the other qualitative study, there was not enough detail to discuss recording or the coding methods or whether triangulation was used.
The future is bright for animal-assisted therapy and occupational therapy. There's a lot more research to be done, including using larger sample sizes and a more diverse population for future studies. OT should have training in the use of animal-assisted therapy and can receive this through continuing education programs. There's a moderate amount of research that indicates that using animal-assisted therapy increases the motivation of children when receiving occupational therapy services. Following this slide is a list of our references used in this study. Thank you very much for listening, and we hope you consider animal-assisted therapy.